everybody. This is Kat Lyons from 9 Health, and this is our Health Happens show, our weekly Facebook Live show that we do every Tuesday. We bring you all of the objective health information that you need. November is American Diabetes Awareness Month, and at 9 Health Fair, you can actually learn about your diabetes risk through our blood screenings, our A1C screening, and we just have a couple of fairs left for the season. We're wrapping up on November 23rd is the very last one. So make sure that you head over to our website, 9healthfair.org, 9healthfair.org to check the final fairs that are coming your way. So today we are with Dr. Michael McDermott. You are the director of the endocrinology and diabetes practice here at University of Colorado Hospital.
Right. Yeah.
So first, let's go ahead and jump right in. We're going to be talking about diabetes today. So there are different types of diabetes. So what are those and what exactly is diabetes?
Okay. So diabetes is, actually it's not one single disease. The most common feature of diabetes is elevated blood glucose levels. There's one type called type 1 diabetes. It's a disorder where your body's immune system destroys the cells in the pancreas that make insulin, and so those patients that have type 1 diabetes don't make any insulin, and their blood sugar gets very high. They have to take insulin to control their glucose all the time. That's the only significant treatment for that, and that's about 5 to 10% of all the 30 million Americans that have diabetes. About 5 to 10% have type 1. The most common is type 2. Type 2 results from a strong genetic predisposition. So if you have one parent, you have a much higher risk of getting type 2 diabetes if one of your parents has it. If both of them have it, you have a very high risk. So you start with the genetic predisposition, and on top of that, there's usually something that precipitates it, like becoming overweight or being on prednisone, for example. So when that happens, the blood glucose level becomes elevated. And whether a person has type 1 or type 2, the blood glucose level is elevated, and that damages the kidneys, the nerves, and the eyes, and the heart. And so diabetes is a leading cause of blindness. It's a leading cause of amputations. It's a leading cause of kidney failure. While we have worked very hard to try to prevent people from getting diabetes, we haven't been very successful at that. And so screening programs like this are designed to help us detect it early. What we have been successful, though, is treating people who have diabetes so that the incidence of kidney failure, eye disease, and nerve disease has gone down very significantly because our treatments for diabetes are very good. However, our goal ideally would be not to let anyone get diabetes so that we don't have to treat it.
Right, just focus on the prevention.
And so prevention helps by diagnosing people before they have diabetes, but they're in the stage that we call pre-diabetes.
Mm-hmm.
So for perspective, 1 out of every 3 people in Colorado has pre-diabetes. And if they don't take steps to prevent that from progressing, most of those people will develop diabetes in the next 10 years. So when people have pre-diabetes, that's the stage where lifestyle intervention is the most important intervention that you can make. So healthy diet, regular exercise, good sleep habits, and weight loss are the key features that help people not progress from pre-diabetes to diabetes. And in fact, sometimes people with pre-diabetes go back to normal. So one of the things that we do at the 9 Health Fair is we screen people's blood glucose. We screen their hemoglobin A1C, which is a marker of how much their blood glucose has been elevated over the past 3 months. And we can diagnose prediabetes by an elevated A1C or an elevated fasting glucose if they're mildly elevated, or we can diagnose overt diabetes if they're more significantly elevated. And at that point, people can take action. They can do things, like I said, lifestyle measures, diet, exercise, good sleep habits, and weight loss that'll prevent progression to diabetes. And so that's one of our biggest goals at the 9 Health Fair, is to diagnose people early on in when they first have diabetes, or ideally when they have pre-diabetes, so that we can prevent it from progressing.
Perfect. And can you tell me a little bit about the indicators that people would want to look for if they're trying to assess their diabetes risk?
So the one obvious risk is having one or both parents that have diabetes. So whether you feel well or not, if you have a parent with diabetes or you have two parents with diabetes, then you're already at risk. If you're a woman and you develop diabetes during pregnancy, called gestational diabetes, then you're at risk for having permanent diabetes. If you've ever taken prednisone and your blood sugar became elevated, you're at risk for getting diabetes on down the line. Now, many people develop diabetes and don't get tested for it for quite some time. So it's important to know that there are some symptoms that may help a person recognize the possibility that they are developing early diabetes. So when the blood sugar is elevated, people typically have excessive thirst. They feel like they need to drink water all the time. They have excessive urination. They may be going to the bathroom multiple times at night, and blurred vision. When people have those symptoms, they really should either come to the 9 Health Fair or go to see their primary care doctor to get checked, to have their blood sugar and their A1C checked, because those people might in fact have diabetes. There are other causes of being thirsty and having a lot of urination and blurred vision, but diabetes is one of the most common and most important ones. So if people have those symptoms, they really ought to get them checked out. Now, some people don't have any symptoms whatsoever, and we diagnose diabetes just by the simple blood tests that the 9 Health Fair does or that people do in their doctor's office. So I think you should be on the lookout for those symptoms, especially if you have a family history. Mm-hmm. But even without that, we're surprised at how many people are diagnosed every year with pre-diabetes or diabetes by getting just the simple screens that we do at the 9 Health Fair.
Mm-hmm. Yeah, no, that makes perfect sense. So make sure you guys get out to a 9 Health Fair, take a look at the hemoglobin A1C and the blood chemistry, because that kind of gives you a bigger picture of your risk for diabetes. So make sure that you do that. Now, if you're just joining us, we are here today with Dr. Michael McDermott, and we are talking about diabetes prevention today. And the risk, how to determine your risk for diabetes. So, Dr. McDermott, if somebody goes to a 9 Health Fair and they take these screenings, when they get their results back and their numbers for glucose are elevated, or your A1C is elevated, or out of range, what should those people do next? What are the next steps for them?
Well, the first thing is to know when the blood test was drawn in relationship to when they last ate. So we judge how elevated the blood sugar is based on whether a person has eaten or not. So if an elevated fasting glucose may not be the same, it may not be elevated if that was after a meal. So they should take those numbers, the glucose level and the A1C, and talk to their primary care doctor and tell them if these were done fasting or they were just done randomly sometime during the morning. The A1C is not affected by whether you've eaten or not, but the glucose is. It goes up clearly quite a bit after a person eats, so we have to interpret the blood sugar level based on whether a person's fasting or not. And a lot of people come to the 9 Health Fair, throughout the morning or afternoon, and they have eaten. So they really have to be equipped with that information when they present these numbers to their doctor. But a fasting glucose over 100 is prediabetes, and a fasting glucose over 125 is diabetes. So those are just some numbers to keep in mind. And a hemoglobin A1C of 6.5% or greater, that's also diabetes. And so particularly if someone has those numbers, it's very important to talk to their doctor. The earlier you control diabetes, the better it is and the easier it is to control long term and the less damage it does. In fact, when we find it early and treat it early, it doesn't do any damage in many people.
And it's easier to manage once you
Yes.
kind of get a grasp of where you are and where you stand. So I know that you mentioned a little bit earlier in the episode about a couple of different ways that you can prevent or manage type 2 diabetes. Can you elaborate a little bit on that?
So the lifestyle measures that we talked about, first of all, regular exercise. If people are not exercising any, they should start trying to walk at least 30 minutes a day. And if they already are exercising, they should try to increase by about 30 minutes at least of walking. And that helps to reduce glucose even when the weight remains stable. But often people will lose weight with that. They should cut back on their overall calorie intake and reduce the number of carbs. I'm not proposing that people go on low carb diets, but I think that reducing the number of starchy carbs and sweets is also a good way to reduce your risk of getting diabetes. And then losing weight, 10 to 15 pounds of weight reduction decreases the risk of diabetes remarkably. So people don't have to get back to their high school body weight to prevent diabetes. They just need to lose 10 or 15 pounds. And that often is very, very effective. I did mention also sleeping regularly. Sleep helps to prevent diabetes as well. So those 4 measures I think are critical.
Perfect. And is there like a recommended amount of sleep that we should be getting?
Well, adults after age 30 should get at least 7 hours, and it's individual. Some people need more. I mean, I personally think 8 is probably an ideal amount for most people.
Okay.
Yeah.
Awesome. Let's see. So if somebody does have diabetes, can you talk about a little bit about the cost? Like, what is the cost of managing diabetes, and what does that look like?
So the costs come from several different things. People with diabetes usually have to do monitoring of their own glucose, self-monitoring of blood glucose, where they have to do a finger stick, take a blood glucose strip, put a drop of blood on that and put it in a meter. So the meter costs, the strips cost, usually covered by insurance, but all of this adds up to a significant cost just for monitoring glucose itself. We have some medications that have been around, like metformin and some of the others that have been here for probably 20 years or more, and they are fairly inexpensive. But a lot of the newer medicines for diabetes are quite expensive, $200 to $300 per month or more. And many times people whose diabetes is not well controlled need not 1 but 2 or 3 medicines, and so they often are taking an expensive medication or insulin to control glucose, and then they have to do the finger sticks to monitor their blood sugar. And that's why diagnosing diabetes early and managing it with lifestyle, and maybe one of the first medications that we use, like metformin, can not only reduce the risk that diabetes is going to do damage to the kidneys, eyes, and nerves, but reduce the cost significantly, because diabetes, once it's advanced, costs a lot of money to manage.
Perfect. If you guys are just joining us, we are with Dr. Michael McDermott, and we're talking about diabetes, risk for diabetes, and how you can prevent that. We actually have Travis behind the camera, so if you have any questions, make sure that you drop them in, and we'll make sure that you get your questions answered. Do you have anything, Travis?
Denise Owen says 1 in 3. That's pretty high.
Yes, that's pretty significant. 1 in 3 Coloradans have prediabetes.
Prediabetes,
yes.
Yeah. And we hope they don't get diabetes from, progression.
Right. So we want to make sure that we're taking those measures, doing the lifestyle changes, monitoring our activity and eating right,
yes.
Getting enough sleep,
sleep.
All of those things. I might not be getting enough sleep, so we might need to check on that. And did you have anything else that you wanted to add to this conversation?
Just to be aware that this is not a disease that anyone asks for. It's not anything to be ashamed of. It's something that we really should find out if we have that. And the only way we can do that is active screening. Many people just don't have symptoms. Some people who have not been checked may have had diabetes for 10 or 15 years without knowing it. And those are the people that sometimes get damage to their kidneys, eyes, and nerves. Because their diabetes wasn't treated. So it's an easy disease to screen for. And it's no one's fault that they have diabetes, but we do have the means to manage it. First of all, as I said, with lifestyle. Second of all, with simple meds, and sometimes with expensive meds. But controlling that really improves the quality of a person's life, and that's really what we're trying to accomplish.
Perfect. And just to stay on top of, your risk for diabetes, you still have a couple of opportunities to get to a 9 Health Fair this season before we are done. We have a couple of fairs up through November 23rd, so make sure you go to our website, 9healthfair.org, to look at a fair in your neighborhood that's coming up. Well, thank you so much for joining us. I think we're going to go ahead and wrap up. like I said, go to 9healthfair.org to find a fair near you. And this month on Health Happens, we will be doing a couple of other conversations about diabetes prevention for American Diabetes Month. So next week we will be talking to a medical nutritionist about recipes that will also help prevent diabetes, which is great. I'm really excited about that. All right, well, thank you so much, Dr. McDermott, and I think we'll sign off here.
You're welcome. Thank you.